So, I have a new job for you. But first, let me introduce you to our head of research.
Hello, my name is Dr. Robert Cromwell. Dr. Blaylock and Dr. Vaughn, I presume. It's nice to meet you. You must be busy adapting to Caduceus, as well as the newly established team. But the director recommended you two, so I would appreciate your assistance.
It's nice to meet you too. It would be our pleasure to help.
Good. I'd like you to participate in clinical testing under the supervision of the research lab.
Let me remind you that it is the duty of those in the medical field to not only cure patients, but to also research and pioneer new treatments. Doctors and researchers must work together to fight diseases both present and future. That's the purpose of Caduceus. There may be some interesting characters here, but they're all excellent doctors. I consider myself very fortunate to be able to conduct medical research among them. And on top of that, we now have the assistance of two truly gifted doctors with the healing touch. I firmly believe that with your precision, the data we'll be able to collect will be invaluable. That is why I'm so enthusiastic about your surgical skills. You don't have any objections, do you?
I appreciate your vote of confidence, even if it is a bit exaggerated.
He's a dedicated professional, although he tends to be long-winded.
Now then, there's an operation I'd like the two of you to perform. The research you're contributing to will give new hope to heart disease patients everywhere. I'll explain as I show you my lab. It's true that many people frown upon our astronomical research budget. Mostly journalists and politicians who are trying to make a name for themselves. You know how difficult it is to produce significant results when conducting revolutionary research. But thankfully, we also have generous supporters such as...
Oh, Dr. Cromwell, you have friends with you today. Would you introduce me? Pretty please.
Isabella. You really should start acting more professional. This is Ms. Vasquez. She's a representative of the Humani Corporation.
I'm Dr. Blaylock.
Dr. Vaughn.
Nice to meet you, handsome.
We're partnered with a number of large pharmaceutical companies and medical manufacturers, including Humani, who've been a tremendous help to us.
I hope my looks don't give you the wrong impression about our company. Humani is a major player in this industry, and I've been known to play hardball when needed.
Humani holds several lucrative pharmaceutical patents and leads the way in regenerative medicine.
Well, if there's anything I can do for you, just let me know.
We have a research specialist from Humani on staff as well. She's a very talented young woman and has produced great results. I believe she's nearby. Cynthia, can you spare a moment?
I'll go get her, Dr. Cromwell.
Thank you. I'd appreciate it. The operation that you'll be performing would not be possible without her help.
Yes, Dr. Cromwell? Oh, that's right. You said you'd introduce me to the doctors today.
This is Cynthia Kazakov. She's a beautiful woman, as you can see, and quite brilliant.
Cynthia Kazakov? You wouldn't happen to be from Trinity Medical School, would you? Valerie? Valerie Blaylock? Yeah, it's me. You became a doctor! Congratulations! Thanks. Wow, I never expected to see you here, of all places. You're going to be helping us? This is great!
I'm Marcus Vaughn. Sorry to interrupt such a touching reunion.
Nice to meet you, Doctor.
So, you two are old friends. I have a feeling this will be a fruitful partnership. Now, Cynthia, can you explain to them about the cardiac patch?
Allow me to explain the details of the operation.
Let's start.
Let's begin We'll be operating on the heart. Please open her up. Let's confirm 3 areas. Follow the gut. If the myocardium path, start by applying antibiotic gel to the occlusion areas.
first myocardium patch, carefully match the location and angle of the patch with a pattern on the heart. The myocardium patch has... Her heart rate is increasing. There's a possibility that the already weak... If you find a hemorrhage, treat it with the... Here's the next occlusion area. Let's continue the operation. What? The guide moved? Does this mean that we'll have to time the placement? Apply the patch when the size of the guide matches the size of the patch. A blood pool is formed. Doctor, use the defibrillator to resuscitate her. We have a pulse. Doctor, the patch can't be applied over a blood pool. Use the defibrillator to resuscitate her. We have a pulse. The patch wasn't placed at the correct angle. The second occlusion area has been treated. One more to go. Her heart rate is... Be careful when placing the patch. Watch your timing. Doctor, the patient's... Use the defibrillator to resuscitate her. We have a pulse. Please watch the guide and place it when the sizes match. Let's treat them all. The patches have begun synchronizing with the myocardium's movement, and her heart rate is returning to normal. She should be all right now. Please close her up. We're finished. Good work, everyone.
That was a flawless operation. Simply perfect. The patch is sure to integrate with the existing tissue. The
I think we'll see excellent results, Valerie.
I'm glad to hear that.
Yeah, I wouldn't mind doing more operations like this one.
Well, we wouldn't want to take up all of your time. The director has already spoken to us regarding the research on stigma. We're currently in the planning stages. In time, we'll show you what we're capable of. Right, Cynthia?
Yes, Dr. Cromwell.
The NIH has received a request for help from a hospital in Texas. They're having difficulty with the diagnosis. Based on the patient's chart, there's a good chance that it's stigma.
So this is what we're dealing with, hmm?
These two pictures were taken only a few hours apart. Look how far the focus is shifted. And its size has increased drastically.
A biopsy was attempted, but they were unable to obtain a sample of the pathogen. The patient will arrive in roughly 3 hours. Vaughn and Blaylock will be performing the surgery.
We'll check the patient's condition upon her arrival and then proceed with the operation.
We're treading on unknown territory, so we'd appreciate your support, Dr. Tsuji.
I highly doubt that you two will need my help, but I'll get ready nonetheless. The patient's vitals are stable. Blood pressure 110/60, heart rate 60 beats per minute.
Any case history?
She was involved in an accident 2 months ago. Laceration on the right thigh. Looks like they used artificial blood for transfusion. Q-heme blood from Syntec Labs, to be exact.
Are there any contraindications?
None that I'm aware of, but can you check with them just in case?
Will do.
The affected area is the liver. The course of treatment will be determined during the procedure. However, I have a feeling this will be different than the professor's case.
Even so, I'm sure our experience with stigma will prove invaluable. Let's stay positive.
According to the test results, this stigma is completely different from the one we saw before.
Okay, let's begin.
The exact nature of this stigma and the types of...
We'll just have to open her up and observe it for ourselves.
Stigma confirmed.
That must be its core.
We can't do anything to the tissue itself. Let's...
Good job.
Okay, then let's continue this and drag the core out. Is this a tumor? Let's burn it with the laser.
The core's been exposed. Use the laser to incinerate it. It's working! The core's being covered by the tissue again. Please drain it. There is still tissue left inside the patient. Please drain it. Vitals are dropping. Is the tumor hardening?
Let's extract it with the Powell procedure. First, use the drain on the hardened tumor.
The draining is complete.
The remaining tissue is
Vitals
hardened?
are dropping?
Does it dry out over time?
The tumor
We can't use the drain.
Good job, Doctor. Don't ignore the other tumors, though.
Not yet.
Now we can use the scalpel to detach it. The tissue has been detached. The tissue has been extracted. It's dangerous to leave the pieces of cellular tissue alone. That's it. Leave the rest to us.
Did it split up?
The core has to be in one of them. Use the drain to find it.
The remaining tissue is hardened? Does it dry out over time?
We can't use the drain on the hardened tissue. Use the laser to soften it up.
More of the tissue has been created. Drain it immediately. Vitals are dropping. Is the tumor hardening?
Let's extract it with the Powell procedure. First, use the drain on the hardened tumor. Not yet.
Now we can use the scalp. The tissue has been detached. The tissue has been extracted. The draining is complete. The tumor has been Good job, Doctor. Don't ignore the other tumors, though. You did it. No presence of stigma can be detected. Let's treat the remaining cellular tissue.
That was an amazing operation. Let's close her up and be finished.
We were
I
able...
hope this is the last time we have to perform an operation in the dark.
We're finished. Great work, everyone.
Stigma's mobility far exceeded our expectations.
You all did a great job treating it. I'm glad you're with us.
Would you expect any less from Caduceus' own special disease counteraction team?
We'll hold a conference on this. Of course, I'll need you to speak regarding today's operation. Your report will also be forwarded to Health and Human...
Just give me a strong cup of joe, and I'll crank it out.
Good. You know, There was no way we could have anticipated Stigma's I was amazed at how well you adapted. I know you have the healing touch, but even so...
I guess I'm just lucky. The results from the liver exam indicate that the patient has been making satisfactory progress. She seems to be recovering well, but it's unclear how this disease was transmitted in the first place. We should continue monitoring her for at least another month.
I see. Well, I think it's safe to say that the treatment was successful. How about the pathogen itself? What have we learned? And please, keep it brief, Robert.
My pleasure, although our analysis is only partially complete. First, the biopsy. Stigma did not match any known organism, meaning it's a new species, so we'll have to come up with a name for it. So how about it, Dr. Everett? You'll be a grandfather one of these days.
Well, my son's only 12. All he thinks about is football.
Oh, well, in that case, I'll ask someone else. Now, regarding the spectral analysis, our attempts to determine its structure resulted in failure.
What? How is that possible? I've never heard of that happening before.
We tried a different machine, but the outcome was the same. We screened for nucleic acid, proteins, glucose, lipids, and ATP, but there were no matches. Stigma consists of an organic compound that is completely foreign to us.
What? This will change the way we think about life itself.
Whoever is credited with its discovery will surely make history. From a medical perspective, it's fortunate that Stigma's infectivity is weak. We're trying to culture it, but so far there's no sign of growth or multiplication. It's going to be difficult to determine the means of infection as well.
This is more serious than we thought.
Madam Director, we have an emergency. Leslie, we're in the middle of an important conference. Deputy Secretary Marshall has collapsed. He may have intraaxial hemorrhaging.
George Marshall, from the Department of Homeland Security?
All right, let's adjourn the conference. Leslie, I want you to prep Operating Room 3 for him. Vaughn, Blaylock, you two will be performing the procedure.
You want us to operate on a high-ranking government official?
I'll explain the details before the operation, so please go make the necessary preparations.
It's been 35 minutes since he collapsed. He's a 9 on the coma scale with mild tachypnea.
We're waiting on the CAT scan results, but it's most likely a case of subarachnoid hemorrhage.
This is his chart from his previous admittance. We performed deep brain stimulation to treat his dystonia.
And he was able to recover from that. Incredible. Looks like the system's produced by Columba and Cornix, the same company that made Elena's pump.
Yes, it's now a subsidiary of Humani. If you have any questions about it, you can ask Isabella.
Director, what's this shadow here on the X-ray?
Oh, that. It's a hippocampus chip. We implanted it at his request.
He didn't want to forget anything, so he opted to have his memory augmented. Huh. I assume they're keeping it quiet. Do we need to worry about being in violation of state law?
We don't have time to discuss that. Now, the hematoma is far enough away from the electrodes, but take care when using the thrombolytic.
Okay, we'll head over to the OR then.
These are the results from the CT. Please take a look. A number of aneurysms have been detected.
All right, let's begin. Since we're operating on the brain, we'll have to be extremely careful.
That bulge on the... Let's remove it before it bursts.
I'm getting the sedative ready. Please, let's detach it with the scalpel while the sedative is still warm. The aneurysm has been detached. The aneurysm... Please hold the vein with the... The vein has been reconnected. Please, we're done treating...
The test...
There's a chance that any... Let's shift our viewpoint.
There it is. Let's...
There's more where we're not looking. Once we treat the ones in sight, we have to quickly change our focus.
Vitals
An
are
aneurysm
dropping?
has burst. Quickly, drain the blood and reconnect the vein. Doctor, please inject it into the bulging vein. The sedative's effect has worn off. Please inject it again. It looks like the situation's calmed down for now. Let's wait a moment and see what happens.
Doctor, please hurry. If all of these burst at once... An aneurysm seems to have burst outside of our current view. Use the magnification tool to find it.
Vitals are dropping?
His vitals are stabilizing. We're done here.
Columba and Cornix's brain electrodes and pump units may seem cutting edge, but it won't be long before they're made available to the general public. Just like the pacemaker. Professor Wilkins had one. Why do I have this nagging feeling? Everyone who's contracted stigma has had some kind of artificial agent in their body. Even that one patient who was transferred here had Syntex Q heme blood. I was using artificial blood with my test mouse, too. I wonder if there's a connection.
Dr. Vaughn, can I trouble you for a moment?
Of course.
I wanted to check on the Deputy Secretary's condition.
I doubt I can tell you more than you already know, ma'am. Since he was brought here promptly, cerebral ischemia was kept to a minimum. And there are no signs of severe paralysis, so we shouldn't have to worry about any after effects. We can't use the MRI, so we'll take another CAT scan tomorrow. Will you be advising on his rehab, ma'am?
Yes, I will. I also need to administer a personality test. Because of his implant, he must be closely monitored. It's sad, really. He's such a talented man.
Yeah, I feel sorry for the guy. But I'd like to leave him in the hands of the others so I can concentrate on stigma.
Agreed. And Dr. Vaughn, it's a shame that you feel the need to keep secrets from us. But I'm hoping that will change.
What makes you say that?
Your cutaneous muscles seem a little more tense than normal. I'm out of practice when it comes to reading faces. Was my assessment accurate? You're a critical part of the Caduceus team. I hope you're not thinking of leaving.
Of course not.